What we're going to talk about today is how sleep changes with age. This is an incredibly important topic if you're over the age of 50. There are biological changes with age, but you don't want to just let them happen. The quality of your sleep has a huge impact on the health of your brain, and I want to teach you all about it. Let's go over the learning topics for today. The first thing we're going to talk about is what is sleep? It's something that we spend over a third of our lives doing, but most of us don't really understand what exactly sleep is and what are all the benefits. We're going to talk about exactly how sleep changes with age, particularly our deep sleep and our REM sleep, which some people could argue are actually the most important sleep phases. We're going to talk about the consequences of a tired brain, and we're going to go over the most common age-related sleep disorders that we see. We're going to conclude, as always, with evidence-based recommendations to help you understand this important aspect of brain health. So let's get started. Why is sleep so important? Sleep is a staple in physical, mental, and cognitive health. Remember, we keep talking about this. We cannot separate one aspect of health away from another. Sleep is really one of those fundamental pieces of all of our well-being. It's important because over 50% of older adults in the United States report age-related sleep change, and they find these changes distressing. And most importantly, there are free, scientifically valid strategies that you can start using to improve the quality of your sleep tonight. The first thing we need to talk about are the 5 stages of sleep and why each one of them is unique and makes its own special contribution to our overall health. The first thing I want you to understand is the sleep cycle. We go through 5 distinct phases all night long. The most important stages of sleep for our purposes today are stages 4 and 5. These stages of sleep are absolutely critical for memory and mood. Stage 4 is considered very deep sleep, and we spend about 12 to 15% of every night's sleep in this stage. This is the stage of sleep when our immune system is really active. This is why it's so critical to get sleep, particularly when we're not feeling well. We give our immune system the best chance at fighting back against diseases and infection in stage 4 sleep. From stage 4, we go into stage 5, and this is also called REM sleep. I think that's something that you've probably heard about. REM sleep is a little bit longer than deep sleep, and it makes up about 20 to 25% of each night's rest. One of the things that happens to us during REM sleep is that we become paralyzed typically. Now, there are some sleep disorders where this mechanism doesn't work, but most of us typically are dreaming very intensely during this time. Our brain actually goes through changes that keep us from being able to move. One of the most important things that happens during REM sleep is that we're processing our emotional experiences, and particularly those that we found highly stressful or traumatic. We're also taking the day's events and reviewing them over and over again, trying to make decisions about what types of things we want to put into long-term memory and what kind of things we can discard. Think of all the things that we're exposed to every day. We can't possibly remember everything, and so the brain wants to make sure that we remember the most important things, the things that are going to help us to survive most successfully. 2 parts of the brain go through a really interesting process when we're in deep and REM sleep. What we see is kind of a mirroring process that happens between the hippocampus, the memory parts of the brain, and our frontal lobes. What they're doing is comparing notes all night long, trying to think about how does the day's events fit in with my previous memories and experiences. Some scientists think that the function of dreams is actually an attempt to figure this out. To figure out how is it that we are going to extrapolate meaning from the day's events. If we're going to understand sleep, we need to understand the circadian rhythm. The circadian rhythm is about a 24-hour cycle in the physiological processes of all living things. Now, this includes animals like us, plants, and fungi. Our circadian rhythm is generally regulated by internal cues like hormones, especially melatonin and stress hormones like cortisol, but it can also be affected by external cues, particularly sunlight, temperature, and eating. I want you to look at this graph here in my slide, and I want you to see how levels of cortisol and melatonin rise and fall during the course of the day and night. This is a normal circadian rhythm. But remember, things can happen to us both inside of us and external to us that can affect this system. When we get to the recommendations, we're going to be talking about exactly what it is you need to be doing to get back into a natural circadian rhythm to support the very best night's sleep you can possibly get. Let's take a couple minutes to just talk about some theories about why it is that we sleep. Like I said before, we spend about a third of our lives in this state, and if you think about it, from the outside, it's not very productive. Of course, there's a lot of things going on behind the scenes, and scientists have spent a lot of time and research trying to figure out what is the function of sleep. So I want to talk about some of these theories with you. The first one is called the adaptive or evolutionary theory. The idea is that inactivity at night is an adaptation that keeps us safe during a time where we would be particularly vulnerable to predators. Next, we have the energy conservation theory, and these scientists believe that the primary purpose of sleep is to store up our energy during a time where it's going to be the least efficient for us to be out searching for food. Now, these two theories are somewhat dated, and what most brain scientists believe now is something called the restorative theory of sleep. And this theory says that the major restorative functions in the body, this includes muscle growth, tissue repair, protein synthesis, and the release of growth hormones, occurs mostly or in some cases during sleep. Sleep is a biological necessity that we need to survive. If we don't sleep, we will die. This is why sleep deprivation is a form of torture in the military. It really drives people crazy, and it will kill someone if you can't sleep. Now, this is super interesting. The restorative aspects of sleep are unique to the brain, and I want to tell you about it. More specifically, sleep helps us to clear away waste products from brain cells. When we're awake, neurons produce a byproduct called adenosine. This adenosine builds up during the day, and it's at night when we can most effectively clear it away from the brain cells. The buildup of this chemical is thought to be related to that feeling of being sleepy. As long as we're awake, we keep building up more and more of this chemical in the brain. During sleep, the immune system can be at its most active, and it's able to get in there and clear it out. One theory is that incomplete clearing from disrupted sleep dramatically increases the level of inflammation in the brain, which you know is a huge risk factor for not getting enough blood and oxygen up to the brain. Now, truth be told, this is not all related to behaviors that we can control. There is a genetic influence on the amount of adenosine that builds up in the brain and our immune system's ability to clear it away. Now, interestingly, caffeine actually blocks the buildup of adenosine, and that's part of one of the reasons that we use it to stay more alert during the day. Sleep is essential for memory. Interestingly, we sleep to learn, to remember, and forget. So let's talk about that in a little bit more detail. During the day, memories are temporarily stored in the brain. During the slow wave sleep at night, as I talked to you before, we are replaying the day's events and deciding what it is we want to keep and what it is we want to throw away. Different types of memory are reviewed in different stages of sleep. As I talked to you about before, during REM sleep, we're really focused on emotional memories. During slow wave sleep, what we seem to be doing is reviewing physical or motor memories that happen to us throughout the day. A great example of this is if you look at someone who's trying to learn a new skill, let's just say skiing. If you're able to get inside their brain and look at their slow wave sleep, what they're basically doing is replaying the motor patterns of learning to ski over and over again in your mind. There's been some really interesting research showing that when you let people sleep after learning something, they wake up more capable and more skilled than they were when they went to sleep, suggesting that there's some kind of consolidation of learning that happens during the sleep process. So let me illustrate that research point with a picture. I want you to take a look at this. As I've told you before, one of the things that's really advanced our understanding of the brain is animal studies. And a lot of these studies have happened on rats or mice. So this example involves that animal. One of the most common research paradigms that's used is called a water maze. And what they do is put a mouse into a water tank, and in the middle of the tank, there's something called a standing platform. They release the mouse on the side of the tank. What the researchers are interested in is how quickly and how efficiently the mouse can figure out how to get to the standing platform. The mice are very motivated to do this because, of course, there's anxiety associated with drowning. So if you look at the picture on the left, this is a mouse that has been sleep deprived, and what you'll see is that they seem to be circling back and forth with no specific pattern. What we infer from this is that learning is not occurring efficiently. The picture on the right is actually after they allowed the mouse to sleep. And what happens is the mice wake up from the nap and they immediately go to the target. And what brain scientists assume is happening is that while the mouse is asleep, they're replaying this motor program over and over again, and they are actively learning. This is why it's so important that young adults know that cramming the night before a big test doesn't work. They would be much better off actually getting a good night's sleep. Let's talk about how sleep changes with age. We know that sleep changes beginning around our mid-50s. What happens is that we spend less total time sleeping and that our sleep cycles shift. We tend to fall asleep earlier in the night and get up earlier in the morning. We spend more time in light sleep and less time in deep sleep and REM sleep. Now you know how important that deep sleep and that REM sleep is. So what we have to talk about in the recommendations is how is it that you can safely and effectively get yourself more deep and REM sleep as you get older. More awakenings happen as we get older, and this is typically to answer the call of nature. Most older adults tell me that they get up anywhere between 2 and 4 times per night to go to the bathroom. They also seem to have more and more trouble getting to sleep after they've been woken up. As we get older, we seem to take more naps during the day. Now, the problem here is the length of time and the time of day that we're taking these naps. And again, once we get to the recommendations, we're going to get really clear on what the rules are for napping. I know that some of you with a particular interest in sleep want to know more. So I've included a detailed graph in the slide presentation for you to reference in the future. This has information about total sleep time, how long it typically takes people of different ages to fall asleep, how much time they're spending in slow wave sleep, in REM sleep. The graph compares the sleep of adults ages 20, 40, 60, 70, and 80. So you can look at your own age or someone that you care about and see what science predicts the quality of their sleep is. So why did these age-related sleep changes happen? Well, we know that there's changes in the brain areas that control and regulate sleep. We know that as we get older, we are releasing less and less hormones, and this can really disrupt that circadian rhythm. We also have medical conditions, including changes in the bladder and prostate, that can get us up time and time again during the night. If we're going to understand sleep, we have to talk about melatonin. Melatonin is the principal sleep hormone that is made in all the cells in the body, but primarily in the pineal gland of the brain during the hours of darkness. Melatonin is a hormone and an antioxidant produced by the pineal gland, which has 4 biological roles. The first one is that it's a scavenger of free radicals that move throughout the body. The next one is that we know it's a regulator of the circadian rhythm. It's also a sleep inducer. An increase in melatonin is a big aspect of what makes us feel like we want to go to sleep. And the final one is that many people believe that it's an anti-aging agent, that if we were able to have less of a decline in our hormones, that all aspects of health would improve. The problem is that this area of research is woefully underdeveloped, and the truth is we just don't understand enough at this time to really know how the hormones and the brain interface, particularly in older adults. But I predict the future of brain science is going to focus on this, and we're going to know so much more in upcoming decades. So the production of melatonin peaks in early childhood, and about the age of 20 or 21, it steadily goes downhill. We see a dip in middle age and a final and further dip in older age, about after the age of 60. So now you understand how important quality sleep is to the immune system. So the first thing that happens in chronically sleep-deprived people is that they get more sick than their counterparts who are getting good night's sleep on a regular basis. If you get less than 7 hours of sleep a night, you're much more likely to have obesity, heart disease, diabetes, high blood pressure, stroke, depression, and even premature death. Scientists think that this is due to the reduced immunity and inflammation that comes along with not sleeping well. The next consequence is weight gain. Adults who sleep less than 5 to 6 hours a night are at a much higher risk of being overweight. Now, different scientists feel differently about this. Some brain scientists feel that this is related to stress hormones, and other people feel that it's more related to behaviors like overeating at night. Remember I said that one of those external cues that can disrupt sleep is food. So we have a chicken or an egg phenomenon here. It's not quite clear at this point in science what the exact cause is. We just know that there's a relationship between being overweight and not being a good sleeper. People who are chronically tired make more mistakes and have more accidents than well-rested people. In 2012, the America Insomnia Survey looked at about 275,000 work-related accidents and attributed them to sleep deprivation. They estimated that this cost the industries up to $31 billion per year. If you drive after less than 6 hours of sleep per night, that's equivalent to a blood alcohol level of 0.1%. This is higher than the legal limit in most states. What's the impact of a tired brain on mood? Now, this, of course, is a two-way relationship, and it's difficult to know what comes first, the mood problems like irritability, depression, and anxiety, or the sleep problems. But what we know is that people who are chronically stressed, upset, nervous, they tend to have poorer sleep. So here's one example of that. In 2009, the Harvard Mental Health Letter published a really interesting statistic where they looked at sleep complaints in patients that were either visiting a primary care office or a mental health practice, and they found big differences between these groups. 50 to 80% of the people in the mental health practice reported chronically disrupted sleep, whereas only 10 to 18% of the patients in the primary care office did. What we know for sure is that chronic sleep deprivation sets the stage for negative thinking. We've all experienced this. When we're tired, we absolutely get more cranky, we get more irritable, and it's really, really hard to see things as they are or to see things positively. In 2015, a study came out that showed a relationship between taking more than 30 minutes to fall asleep at night with the likelihood of meeting diagnostic criteria for an anxiety disorder. I bet you've had that feeling too. Your head hits the pillow and all of a sudden your problems seem even larger than life. Things that didn't bother you so much during the day now feel completely consuming and overwhelming. Now, of course, the problem is that the tireder you are, the more likely you are to get overwhelmed. And the more overwhelmed you are, the harder it's going to be to fall asleep. So what we have here is a two-way relationship. After just 1 week of poor sleep, research participants report feeling sadder and more stressed, more anxious and more worried. A sleepy brain is slower, it's more impulsive, and it has a much harder time making new memories. When we don't sleep, our ability to learn new information can drop as low as 40%. Sleep disruption has its biggest impact on concentration, word finding, memory mistakes, our ability to make good judgments, response time, and impulsivity. Let's talk about the most common sleep disorders that happen in older adulthood. Chances are somebody that you know, maybe even yourself, is living with one of these 6 conditions. We're going to talk about these in detail. The first one we're going to look at is insomnia. Then we're going to talk about sleep apnea, restless leg syndrome, anxiety, medication-related sleep change, and alcohol. There are 2 types of insomnia: initial insomnia and middle insomnia. And what these refer to are people that have difficulty either falling asleep, this is initial insomnia, or staying asleep, this is called middle insomnia. Either one, what you're going to have in insomnia is a lot of daytime sleepiness. And remember, you just learned about the effects of a sleepy brain. 30 to 50% of older adults report difficulty staying asleep, and we would classify that as middle insomnia. Now, there are many different causes of insomnia, and it's up to you and your medical providers to figure out specifically what for you or a loved one is getting in the way. But the most common causes are related to the following: changes in the circadian rhythm that we've been talking about, hormonal changes, specifically less melatonin, stress, chronic pain, and a lack of a daily sleep-wake schedule. We're going to talk about that one in more detail soon. Let's talk about sleep apnea. 1 in 4 older adults has sleep apnea. What apnea means is a pause or a complete stop in breathing that is abnormal. Apneas can last anywhere from a few seconds to a few minutes. When we think about sleep apnea, we judge it on a scale called the apnea index that ranges from mild to severe. The only way to truly know your apnea score is to have a sleep study and have your sleep monitored overnight by sleep experts. But the way we classify it is by how many apneas the person had in a given night's sleep. If you've had 5 to 15, this is considered mild. If you've had 15 to 30, this is considered moderate. Severe is considered over 31 apneas in a given night's sleep. Sleep apnea is dangerous on 2 levels. It reduces the amount of oxygen that's available in your blood. Think about it. The people stop breathing. This means that there's no fresh oxygen coming into the body. It also disrupts that natural sleep cycle that we just learned about. Now, the deeper sleep that you're in, the more likely you're going to have the apnea because your lungs and your brain are at their most relaxed. There's 2 types of sleep apnea, obstructive and central. Obstructive typically refers to changes that happen within the sinuses and the throat, the tonsils, that literally obstruct the breathing pathways. Central refers more to changes that happen in the brain. Either way, there are very effective treatments for both types of sleep apnea, and they range from things called a CPAP to a BiPAP. The risks of untreated sleep apnea are very severe, but the truth is, I think a lot of people don't take it as seriously as they need to. So let me try to convince you how important this issue is to your overall health, but particularly your brain. There's a lot of really good research support for the idea that sleep apnea really hurts your cardiovascular system. People who have sleep apnea are also much more likely to develop insulin sensitivity, including progression into type 2 diabetes. Now, the idea is once you start to have these complications, brain health can suffer more and more and more. So sleep apnea represents one of those early changes that happens in the brain that if you can treat early, you're in so much more of an empowered position to change the course of your brain health in the future. People who have untreated sleep apnea are often more irritable than they want to be, they fret about things more, and they have a much harder time concentrating. They tell me things like, I just feel foggy, I feel like I can't find my way every day. I promise you, if you can get on board with a CPAP or a BiPAP program, if that's what's been prescribed, so many of these symptoms can go away almost immediately. Now we're going to talk about restless leg syndrome. About 1 in 8 older adults have this condition. There are 4 primary symptoms that go along with having restless leg syndrome. The first one is a strong urge to move your legs, sometimes accompanied by a burning or a churning sensation. Symptoms tend to be worse when your body is at rest. Hence the idea that it's a sleep disorder. When you're trying to lay down to go to sleep, people's legs can get all sorts of active. Symptoms improve when people move, but of course this is part of what keeps you awake and disrupts the sleep process from starting. Now again, with most of these sleep disorders, there's a variety of causes, and you need to work with your personal physician to figure out your cause. But I want to talk to you about a few of them because I want you to be knowledgeable about the possibilities. When we look in the scientific literature, what we find is that the many causes of restless leg syndrome include low iron levels, kidney failure or dysfunction, diabetes, rheumatoid arthritis, or the use of multiple types of medications, including different types of antidepressants, antihistamines, and calcium channel blockers. Sometimes it can be as easy as taking away a medication or helping someone correct a vitamin deficiency to treat restless legs. We need to talk about the effect of anxiety on sleep because this is so common. I want to start this conversation by just defining anxiety because I think sometimes people aren't exactly clear on exactly how psychologists think about it. Now, anxiety goes by a lot of different names. Some people call it nervousness, some people call it worry, tension. But how it's defined is as a persistent nagging feeling of fear, apprehension, or dread. The key to clinically diagnosable anxiety is that it's out of proportion to reality, that the threat that the person feels is not truly the threat that is posed by the stressor. Anxiety very often interferes with sleep because, like I said before, we've all had that experience of our stressors and our problems seeming even more intense when we go to sleep at night. Think about it, there's nothing to distract us. We're just left alone with our thoughts. Further, many of us are engaging in not so great coping skills throughout the day that involve things like avoidance. If we stay busy enough, we don't have to think about the things that bother us. When our head hits that pillow at night, it all comes flying back, and it can really interrupt falling asleep. There are a lot of medications that can affect the ability of our brain to fall asleep and also the quality of our sleep. So let's look at this slide together and learn a little bit more. Many medications have stimulating properties to them. That's how they work. They make different cells in our body be more active, more alert, more productive. But this can get in the way of that process of falling asleep. High blood pressure medications like alpha and beta blockers, calcium channel blockers, are notorious for this. Medications like corticosteroids that treat different types of arthritis and inflammation in the body can be very stimulating. Asthma medications, medications for bronchitis, or any type of breathing problems can interfere with sleep. For some people, the memory medications that are on the market can really disrupt sleep. People undergoing chemotherapy often complain about difficulty falling and staying asleep. Any type of over-the-counter medication that contains caffeine, of course, is going to disrupt our sleep and keep us awake. But what I think is that many people don't realize that certain over-the-counter drugs actually contain caffeine. So you want to always make sure that you're really looking at that label. The other over-the-counters that can get in the way are decongestants and things that are there to relieve pain, specifically joint pain. Medications that contain glucosamine, for example, are notorious for disrupting sleep. Now remember, you're not allowed to go changing medications without your doctor's permission. You can get into a lot of trouble abruptly stopping a medication. I'm giving you this information because I want you to make more informed decisions in partnership with your medical providers. Now we're going to talk about the effects of alcohol on the sleep cycle. Many people turn to alcohol as a way to help them fall asleep, and it actually is pretty successful. The problem is that it really fragments sleep and it really affects our ability to stay asleep. Any alcohol within 6 hours of bedtime is going to interfere with the quality of your sleep. A 2013 study suggested that 4 or more drinks on one occasion is linked with insomnia in adults over the age of 55. You're much more likely to have shallow breathing after a couple drinks, and remember, that can really set the stage for that sleep apnea that we just talked about. The other thing that happens with alcohol that people don't commonly realize is that it causes spikes in our blood sugar. If you listen to our lecture where we talked about type 2 diabetes, you know that one thing the brain strongly dislikes are big peaks and valleys in the amount of glucose that's available in our blood system. So if you're taking a drink before you go to bed, you're going to get a big spike in blood sugar, but throughout the course of the next few hours, it's going to absolutely plummet. This is probably one of the reasons that alcohol disrupts our sleep, but it's also doing damage to your brain cells in a similar way that diabetes affects the brain. Let's talk about the problems in treating sleep issues with medications. The point here is that I don't want you to just turn to medications as a first attempt at getting a better night's sleep. In a few minutes, we're going to transition into the recommendations part of this lecture, and I'm going to teach you some scientifically proven strategies to improve the quality of your sleep without medication. Why this is so important to me and other advocates who care about older adults is because these medications can actually be pretty harmful. In addition to being harmful, their actual effectiveness has been called into question. There are 3 types of medications that older adults typically turn to for help with sleep. The first one are the benzodiazepines. We get concerned about these because they dramatically increase the risk of falling and having a fracture while you fall when you're under the influence of these medications. Research has taught us that we have greater cognitive symptoms when using these medications over time. This includes increasing your risk of dementia. Another commonly prescribed medication is zolpidem. This also goes by the name of Ambien, and a few research studies have shown that it too can increase falls and confusion in older adults. The next class of medications is antihistamines. These are things like Benadryl or medications with a PM at the end of the name. If you've been listening, you know that there's a lot of risks associated with anticholinergic medications, so we cannot have older adults relying on these medications to get to sleep for more than just a short period of time. So now that I've gotten you on board with exactly the benefits that sleep offers us, we need to talk about how to optimize this important aspect of our health. You might have noticed a pattern to my recommendations. The first thing that I always want you to do is take stock of what's going on with you now. And when it comes to sleep, what I want you to think about is answering this very simple question. During the day, are you sleepy? Do you wake up feeling well rested, or are you dragging most of the day? Particularly if you wake up after a night's rest feeling tired, you need to be concerned. Sleep needs do vary across individuals, and as we now know, they do change with age. But what science tells us is that all people need between 7 and 8 hours of uninterrupted sleep to function at their very best. So this has to be our goal. If after sleeping between 7 and 8 hours per night, you wake up and you do not feel refreshed and ready for the day, you need to talk with your doctor about the possibility of having a sleep disorder. I'm going to tell you later in these recommendations exactly what steps that you need to do to get that assessment going. I want you to start to monitor your sleep with the behavior tracking sheets that we have in the workbook that goes along with this series. I want you to track the times that you get into bed and the times that you get out of bed in the morning. I want you to determine how many times you woke up in a given night and the total number of hours that you think that you've slept. I specifically want you to write down the time and the length of any naps that you might be taking during the day. And at the end, I want you to take note of how you feel when you get up in the morning. Do you basically feel refreshed, or do you still feel tired? One of the things you might want to consider if you want to get really scientific about your sleep is something called a sleep tracker. These have been getting more and more affordable as they've been out now for a couple years. I started to use one recently, and I think that it's actually really helpful and really interesting to understand what's going on with your sleep. You can get these now for as low as $30 or $40. How these things work is that you wear a bracelet that monitors your activity throughout the night. Through the science of technology, they're able to tell you when you fell asleep, how many hours you were asleep total, how many hours you were in light sleep, how many hours and minutes you were in deep and REM sleep. They can tell you how long it took you to fall back asleep after you were awoken during the night. This can be critical information for figuring out specifically for you how your sleep is disrupted. Remember that one of my rules is we have to get a good handle on how things are going for us now before we start any behavior change. We need a baseline to compare our future behaviors to. I want to encourage you to practice these 6 pillars before you take the step of taking a drug or a substance to help you sleep. So let's go over these in some detail. I want you to try to get into a good routine with your sleep. I want you to try to go to sleep and wake up at about the same time every day. It's really important that you try to keep this schedule consistent. I want you to avoid late afternoon naps. Now, if you have to take a nap, I want you to try to set an alarm so that you don't sleep more than an hour. And please don't take any naps after 3 p.m. I also want you to try to avoid screens, particularly in the 2 hours before you want to go to bed. The blue light that comes across in screens has the same effect, you might remember, on our brain as sunlight, stimulating our brain and giving us the message that it's time to wake up. I want you to turn off your tablet and the television at least 2 hours before you go to bed. I want you to reduce the non-essential items in your bedroom. Get rid of that exercise equipment that you've been using to dry towels for the last few months. Many brain scientists feel that you should not have a television in your bedroom. You shouldn't be doing things like eating or watching TV in the bedroom. Most scientists will tell you that the bedroom needs to be used for 2 things. The first thing is sleeping, and I'll let you use your imagination about the second thing. Don't lie in bed any longer than 20 or 30 minutes if you're having trouble falling asleep. I want you to get up and try to do something relaxing and distracting. But remember, no screens. I want you to develop a pre-sleep ritual so you can start to give your brain consistent signs and signals that it's time to wind down. This is going to help your melatonin to increase, and you're going to start to get that sleepy feeling naturally. So about an hour before you go to sleep, I want you to start preparing your brain for this transition by avoiding stimulating tasks. Things like reading something you find relaxing or listening to music are excellent ideas. Physical or psychologically stressful activities, in contrast, cause the body to release stress hormones, which make us feel more alert and ready for action. This is, of course, the exact opposite thing that we want our brain to be doing when it's time to fall asleep. If you find yourself preoccupied with worries or things that you want to get done in the next day, I want you to keep a little worry notebook by the side of your bed. Get all of those things down on paper so you remember them in the morning and you don't feel the need to hang on to them and review them over and over again. I want you to try to reestablish a normal circadian rhythm. Remember when I talked about all the things that can get us off track? We have to do things every day that get us back on track. So let me tell you exactly what brain scientists know. The first thing I want you to do is start to sleep with your blinds open. This is going to help your brain be exposed to the natural rising of the sun. Sunlight and melatonin have a very intimate relationship. I want you to avoid stimulating substances like alcohol, caffeine, and nicotine after the afternoon. These things can hang around in our bloodstream for a really long time and really activate the central nervous system. And like I said before, it's really important that you reduce your screen time, particularly in the evening. I'd like you to consider starting a meditation practice. There's been some really intriguing research that's come out recently that suggested that older adults in particular can get more time in deep and REM sleep after they start a meditation practice. Let me tell you a little bit more about that. Senior meditators spent more time in slow wave sleep, about 11% as compared with 4%. How scientists think that a meditation practice can improve sleep is by increasing the amount of melatonin in the brain naturally. I want you to know that there's a lot of free resources online that can help you understand what meditation is and how to incorporate it into your everyday life. I've included a link here to one on YouTube that I've found particularly helpful, and remember, this resource is absolutely free. One of the questions that I get asked a lot is there a safe and effective role for melatonin, particularly in age-related sleep changes? In general, there is sufficient evidence that low doses of melatonin improve the initial sleep quality of older adults that are experiencing symptoms of insomnia. A 2014 meta-analysis concluded with the following advice. They advised that the lowest possible dose of melatonin was best to mimic the normal physiological circadian rhythm of melatonin release. So what this means for you is that you want to try to get that 1 milligram dosage of melatonin that's on the market today. Now earlier I did mention that it can sometimes be hard to find this lower dose in stores, so you might have to get it online. And what we want you to do is to take it about 1 hour before the time of desired sleep. One thing you do have to understand, though, is that brain scientists do not know the long-term effects of using melatonin, either at the lowest levels or at the highest levels. So in that sense, buyer beware. Now what we're going to talk about is cognitive behavioral therapy for sleep problems, specifically for insomnia. When participants went through the program of cognitive behavioral therapy, about 60 to 70% of adults who went through a cognitive behavioral trial for the treatment of insomnia found that they were helped just after 4 to 5 sessions. If this is something that's of interest to you, you want to look in your local community for a mental health provider who offers this type of therapy. Psychologists are a great place to start. Let's go through a list of the most common medical conditions that can underlie sleep problems. The first one is acid reflux and heartburn. Sleep position has a lot to do with this. There are even some pillows now that are sold to give you a little bit of a pitch when you sleep to keep those stomach acids low and not coming back up in the throat, which can be distressing and keep you awake. Diabetes presents multiple problems in terms of sleep. We can have rising and falling blood sugar levels, we have increased urination, and people with diabetes can have night sweats that can absolutely keep them up at night and keep them from falling back asleep. Many heart conditions can result in increased shortness of breath when extra body fluid accumulates around the lungs when we're lying down. Arthritis is a common medical condition that can keep older adults up at night with aching joints. Underlying kidney disease can also keep us up at night, running back and forth to the bathroom. And that final medical condition that I want you to think about is anxiety. Sometimes we can prioritize physical health conditions over mental health conditions, and I don't want you to make that mistake. Things that go on in our mental health are just as important and just as valid to treat as physical health symptoms. I hope that I've convinced you that sleep apnea poses a very significant danger to your brain health. So let's talk about the scientifically proven strategies for treating both mild and moderate to severe sleep apnea. If you've been told that you have a mild case of sleep apnea, you may very well be able to treat yourself, and you may not need a formal sleep machine like a CPAP or a BiPAP by doing the following things. The first thing that doctors recommend is that you lose weight if that's something that's been recommended. The next one is to avoid sedative medications and alcohol. Remember, it's very easy to fall into the trap of thinking that those things are going to help you when actually they really disrupt your sleep architecture. You might want to try nasal sprays or those breathing strips that are on the market. It's really important that you don't get in that cycle of sleep deprivation, because that's only going to make it more likely that when you do sleep, you're going to sleep really hard. You're going to go into those deep and REM levels of sleep much more quickly. And remember, that's when apneas tend to happen. What we want you to be doing is transitioning from stage 1 to 2 to 3 to 4 to 5 of sleep naturally all night long. It's really hard to do this when you're sleep deprived, and it's extra hard, almost impossible to do this, even if you have the mildest forms of sleep apnea. Now let's talk about the treatments for moderate to severe sleep apnea. I've been talking about this thing called a CPAP. A CPAP prevents the airway from closing or completely collapsing by the use of pressurized air. Now, there also are variations on the CPAP called the BiPAP or an APAP, and the use of these depends on exactly what type of sleep apnea you have and how severe it is. What you need to know about these breathing machines is that you have to use them for more than 5 hours per night for at least 2 weeks to see their benefits. Patients who come back to see me after they've been able to become compliant tell me that they've not felt as good in years. They're less irritable, they're clearer in their thinking, and they think that their memory has improved. If after trying everything that we've talked about today, you're still worried about your sleep and yourself or a loved one, I want you to talk to your primary care provider about the possibility of a sleep study. Now, I know the idea of going into a medical lab or a clinic to have people watch you sleep can be a little bit stressful, even a little bit intimidating. But remember, we have to have these high-quality assessments to identify the problem. It's only by identifying the specific problem that you have that your medical care can become personalized. And I want to conclude with a final plea. One thing that I really hope you come away from this lecture knowing is the danger of the over-the-counter sleep aids. If you have to take them, please only use them in the short term and become more educated about the dangers that they pose to you in the long term. So that's the end of our lecture today on sleep. I hope you feel more educated and empowered about this very important aspect of our brain health. I'll see you next time. Thank you.